and show their spark. Popularization of science is the main objective of IVSA among classes and masses and among the society at large. IVSA Nagpur, during its 38 years of existence, is involved in taking science from lab to land. All our 150 plus members of Nagpur branch, most of them are PhDs, doctors, engineers, teachers, professionals, entrepreneurs, housewives, are actively involved in conducting various programs like science talk, lectures, science lectures, quiz, seminars, cooking competitions, seminars, and now webinars to take our flag forwards. I have an exhaustive list of programs actually, but this is for want of time, and this is not a platform to read the whole list. To IVSA has 11 branches spread over all over India, and with the headquarters in Mumbai. And some of the IVSA members are Padma Bhushan and Padma Shri. You must have seen the highest science award was awarded to Dr. Rohini Godbole, and you must have seen in newspapers. Dr. Rohini Godbole also happens to be an IVSA member. IVSA is the full form is Indian Women Scientists Association. So welcome you on for this program. Thank you.
Thank you, madam. Now I cordially invite Dr. Seema Somalwar, our program coordinator and principal Nicholas Mahila Mahavidyalaya, for her introductory remark.
Thank you, Bharti. My greetings to one and all here. Welcome, dear Dr. Bhalerao and Anju Bhalerao, Dr. Pradnya Bhalerao, Dr. Anuradha Gadkari, and all other members of IVSA and my dear students. It's a wonderful gathering here today. Incidentally, I also happen to be an IVSA member and coordinator for this program. So it gives me a lot of pleasure because we are actively engaged at college working for women, this being a women's college, actively engaged to empower women beyond their classrooms. Therefore, organizing such programs, issues which are very dear to women is one of our important tasks here. Also at IVSA, we are actively engaged in organizing various activities pertaining to science, taking science to women and children especially, as Madam Bhalerao, Pradnya Bhalerao has already highlighted. And my dear students, this has been a very a difficult time, a very unexpected time, and a time when everybody has to go through very unprecedented situations. Doctors have been at a very different time altogether. We have been watching Corona and its impacts from through our own eyes and whatever has been happening in our neighborhood to our relatives. But we have some eminent personality amongst us today, a doctor, a leading prominent doctor in Nagpur, Dr. Anuja Bhalerao, who's been working constantly during the lockdown and has seen conditions of Corona patients, of otherwise women patients from a very close quarter. As before the program began, I was asking her, she said every day they walked out with a lot of risk, and today also they are going to the hospitals with a lot of risk. I want to thank Dr. Anuja and all such many doctors who have been patiently working with the patients, who have been dedicatedly working. There have been a lot of challenges, and I believe the challenges are not still over. The topic, women's health, is a great concern, as it is with our nation, because it happens to be one of the greatest factor in growth indices. women's care, lot of budget has also been allocated. And as I said, we are not really aware of the challenges, the health issues, because whatever we know is what we see within the families, within the neighborhood. There is a large platform, larger, much larger than this, where things have been very different. And so to understand situations, to create more awareness amongst us, I thought it was an appropriate talk to conduct for our college. Thank you, therefore, IPSA, and thank you, Dr. Anuja, for being here. Without taking too much of time, I will now hand over mic to Dr. Bharti Ganu for further proceedings. Thank you.
Thank you, Somalwar Madam. Now I would like to invite Dr. Rita Israni to introduce our guest speaker for the day.
Should I start, madam?
Yes. Yes.
Greetings to one and all, and a very good afternoon to all. Just short introduction of our speaker, Dr. Anuja Bhalera. Madam is MBBS, MD, FIC-MCH, FUR, PSSSI. Madam is an operating faculty at Urogynecology in the Department of Obstetric and Gynecology at NKPS Salve Institute of Medical Sciences. She is a professor and HOD with 29 years of teaching experience. Madam has a bundle of achievements to her credit, like fellowship in urogynecology, then Best Teacher Award. She had Best Research Project Award, faculty at national and international conferences. Madam has 32 publications in national and international journals. She is the principal investigator for WHO PPH bundle project with Harvard University. Madam has best video presentations at AAGL and papers at various national conferences. Over and above, Madam is a national cricket player and she has 24 hours solo power flying to her credit. Madam is going to give her presentation on a very current subject, that is post-COVID challenges with special reference to women's health. Thank you. Over to Bharti Madam.
Thank you, Rita Madam. Now I invite our guest speaker, Dr. Anuja Bhalera Madam, for her talk. Madam, I made you the host now, so you can share your screen.
Yeah.
Am I audible?
Yes, madam. Yes.
Hello.
Yes, madam. You are audible.
Good afternoon, IFSA member and dear students. A very good afternoon to all of you. At the outset, I want to thank Indian Women Scientists Association with their convener, Dr. Pradnya Bhalerao, Dr. Tiwari, Dr. Seema Somalwar, and all the executive members. Friends, we, the inhabitants of this third planet of our solar system, Earth, struggled in fighting COVID-19 and grappled to survive the disease. COVID word has literally slithered into our dictionary, our lives, and probably our far future. So we are here today to talk about and discuss about post-COVID-19 challenges with special reference to women's health. We all know that coronavirus disease, also called as COVID-19, which is caused by SARS-CoV-2 virus, led to a pandemic. And this was an unprecedented global public health concern. On March 11th, 2020, it was World Health Organization who declared coronavirus disease COVID-19 as a pandemic, which literally started from Wuhan, China. And what happened to our elderly women and girls? They were fraught with fear and anxiety. The elderly women for the concern of their lives, and the young girls because their future was at stake. When we talk about coronavirus, the patients can be asymptomatic. They may have less common symptoms, or there may be serious symptoms, ranging from difficulty in breathing, chest pain, and loss of speech and movement. With these symptoms, when a person comes to the health worker, the person is made to seek immediate medical attention when the report comes positive. People with mild symptoms could be managed at home, but with severe symptoms required hospitalization from 14 days to 21 days, 5 to 6 days being the incubation period. Women or people who more than 60 years of age with lung disease, heart disease, diabetes, and immunocompromised status, that means those who were on steroids for diseases like bronchial asthma, or who were receiving anti-malignant treatment for cancer, or those with kidney diseases suffered the most. The women were not behind. Young women, women of reproductive age group, and older women also suffered. As far as healthcare industry is concerned, along with the economy as a whole, was all at various crossroads, making us change, adapt, and evolve. Pandemic literally has completely changed the way we work. It is imperative for us to prepare ourselves today to deal with the forthcoming crisis by following various safety precautions that I'm going to tell later. As Nelson Mandela said, and I quote, "I never lose. I either win or learn." So friends, we need to educate ourselves and keep learning with every passing day that comes to us. So what is health? According to WHO, health is not only the physical well-being of a person, but it is mental, social, and economical well-being of a person constitute health. And all this got affected with COVID-19, the mental health, the social health, and the economic health. We all know India is having such diversity. The social fabric of India thrives on interdependence, both emotional and economic, within families, relatives, and friends. And everyone, all this fabric suffered so much with COVID-19. As far as the social impact of COVID-19 is concerned, the countries went into recession, job loss led to poverty. There was worsening of socioeconomic inequalities, and the health related things were compromised so much. As far as the social and psychological perspective is concerned, because of the cultural, festive, religious, and entertainment restrictions, the people went into depression and got affected mentally. There was a lot of domestic violence. There was exploitation. But one good thing happened, that nationalism was seen well. Many people got addicted. Women had unplanned pregnancies, abortions, and had lots of violence. Since the medical help was not available physically, telemedicine came into being, and that was the way the people were treated. So if we see all and all, the long-term implications of the pandemic are really far-reaching. All those being at home, their minds got affected because of the recession, because of the job losses. There were challenges in paying bills, inability to access food for a lot of people, There were so many conflicts because they were separated from their loved ones, which led to poorer mental health. It increased depression, anxiety, stress, distress, low self-esteem. There were suicidal tendencies. People felt lonely, and many of them suffered sleep disorders. If we happen to see the healthcare services, they literally collapsed because there were no guidelines, there were no protocols to start with. There were so many challenges in diagnosis, quarantine, and treatment. The burden was huge for functioning and for treating patients. Doctors, the other healthcare professionals were overworked, and there was overloading of the medical shops too for medicines as well as PEPs. So what do we need to do at this juncture? We need to understand the aftermath of this crisis and find a solution to end it, stepwise and with our collaborative efforts. Morbidity and mortality due to COVID-19 in India is largely attributed to comorbid conditions, that is non-communicable diseases. Which were these non-communicable diseases? Were uncontrolled diabetes, hypertension, cardiovascular lesions, that is heart disorders. People gained weight. On the other hand, there were so many people who went in for malnourishment. There was less prevention of so many diseases because of discontinuation of treatment. Friends, young friends over here, this is for you all now. What was the effect on us, the young friends? I'm calling myself young. The colleges, because of the lockdown, had stopped taking lectures, so there were online lectures. There was no socializing. Being at home, inability to go for further higher education, loss of jobs, loss of finances led to lots of weighty issues. Many young girls gained weight. Some of them went into depression, and there were lots of cases of unplanned pregnancies. A very popular disorder which we happen to see in young girls is polycystic ovarian syndrome. Everybody, whenever we talk about polycystic ovarian syndrome, the antenna are up. What is this polycystic ovarian syndrome? This is a hormonal imbalance between the male hormones and the female hormones. There is anovulation. Anovulation means, normally we all know that there is ovulation which occurs when the ovum is released from the ovary. And if the ovum is getting released from the ovary, it leads to regular cycles. So whenever there is anovulation, the girls usually come with irregular cycles, means their cycles are extended. Some of them are getting it after 60 days, some of them are getting after 90 days. And to the extent that some of them do not get their cycles till they take some hormones for getting a period. There is increase in the male hormone, as I said, and this is responsible for excessive hair growth and acne or pimples. Acne is a severe form of pimples. And on ultrasonography, we find ovaries which are larger and they are cystic. Do we get to see PCOS only in overweight girls or people? The answer is no. You get to see PCOS in lean patients also. And how do we diagnose it? By certain blood tests and ultrasonography. A good history is also important for diagnosis of polycystic ovarian syndrome. Why to worry about this? What is the effect of this polycystic ovarian syndrome? At a later date, if a girl is having polycystic ovarian syndrome, she's going to have anovulation, and at a later date, she may not be able to conceive. That means she may not be able to be pregnant. There is increased chances of cancer of the uterus. And during her further life, she may have diabetes, hypertension, hyperlipidemia, that is called as a metabolic syndrome. So treatment of polycystic ovarian syndrome at as early as possible is so important. Why do I get pimples? Is the question most of the girls with polycystic ovarian syndrome come. because of the male hormones. During bodily changes, extra oil is produced by the skin glands, and a pimple develops when this oil leaks out of the follicle into the skin, and sometimes it forms a pustule also. When the pimples are mild, they can be treated at home, but severe condition needs doctor's help. The treatment for polycystic ovarian syndrome is lifestyle modification and various drugs. I'm going to talk about this in details after a few slides. The other problem that our young girls face is problems with menstrual hygiene. And I have been told that you've already had lots of lectures on this, so I'm not going to go into the details. But this is a very important component of the young population. Another important disorder that we get to see is thyroid disorders, especially hypothyroidism. The girls become obese, they are lethargic, laziness, they don't want to do anything, the skin becomes thick, and there are so many things. The diagnosis and treatment of thyroid disorders timely is an important aspect of young medical health. You all must be appreciating this beautiful bowl of salads and thing, and this is what is advocated for people who are overweight. A balanced diet comprising of grains, vegetables, fruits, milk, meat or beans, whatever is the, depending upon the whether the person is vegetarian or non-vegetarian. But you see the number of calories that one really requires. If we happen to see a girl who's actively managing her day-to-day lives, she would require around 2000 calories. But one who's been at home, not doing lots of exercises, you may not require that many calories. For elderly people, the number of calories that we require is much lesser than this. So a balanced diet, one really needs to think as to how much work I'm doing, how much exercise I'm doing, whether my lifestyle is sedentary or whether I'm working a lot. It all depends upon that. There is a hue and cry which is going on regarding whether to go in for small frequent meals or whether to go in for intermittent fasting. Both are good. Small frequent meals, that instead of taking say 2 chapatis and rice at one time, one should take 1 chapati and 1 chapati with vegetables and 1 chapati with vegetables after 2 hours. Intermittent fasting of about 15 hours is advocated. And how should be our diet? High protein, low carb, with green leafy vegetables, lots of fruits, and one should keep ourselves hydrated with minimum of 3 liters of water. Now, why this is important? Because we want to excrete lots of toxins through the water intake. Prevent salt, soya, soft drinks, sodas, because they are all sugary and they are responsible for the increase in the weight. Exercise is very, very important. Aerobic and weight training. When we talk about aerobic training, the young girls can go in for Zumba, running, skipping, dancing, and weight training is very important to help you sculpt. That means it's going to give your body a shape. It improves the strength and endurance, helps build the bones and muscles, helps control weight. And when you control weight, it has been said that if you lose 10% of weight, the menstrual problems, the irregular cycles will come back to normal. The chances of conception becomes high. It reduces anxiety because of release of positive hormones. It increases your self-esteem and gives you a great body. But overdoing it is not enough. How much is enough? Say about 30 to 45 minutes of walking, 40 minutes of bicycling, 30 minutes of dancing, 20 to 25 minutes of football or basketball playing, and swimming. These are the important aerobic exercises that one needs to do only for a stipulated period of time. And one needs to keep a balance between food and exercise. Be sure to remain within your dietary calorie needs. Be physically active for at least 30 minutes most of the days of week. All this I am talking for young girls. As far as the elder women are concerned, I'm going to go further after few slides. I'm going to talk for them too. About 60 minutes a day of physical activity for young to prevent weight gain, and for sustained weight loss, a physical activity of 60 to 90 minutes per day is required. Girls must be thinking what I'm going to talk on now. The issues in sexuality. How to make the right choices. How to talk about sex. How not to get hurt by various sexually transmitted diseases. How to stay healthy. How to avoid pregnancy. These must be the questions that must be going on in everyone's mind. And let me tell you, friends, one of the most traumatic experiences the world sees is unwanted pregnancies, to the tune of 2 to 2.4 million adolescents and and young girls going for abortions, which are maybe legal or illegal. They may be safe or they may be unsafe. And unsafe abortions leads to infections, bleeding, chronic pelvic pain, and later they are not able to conceive. So what is good is to speak to a qualified gynecologist. You should have good education regarding contraception. How to choose a proper contraceptive is very important. In the end, relax. This is too much. Believe it or not, the adults you know have been through the same hang-ups, but they might have forgotten how difficult or confusing it is that we grow up. So, and the last and most important thing for my young friends here is be economically independent. Pursue your hobbies, take up some courses which will make you economically independent. As far as the elder friends are concerned, exercise and nutrition is again a very important component of reducing the mental health or improving the mental health by yoga, meditation like pranayam, kapalbhati, stretching exercises. In the elderly women, slight amount of weight bearing exercises is very important because they prevent osteoporosis. I'm not saying that pick up big weights, but minimal weights should be used for prevention of osteoporosis. Similarly, calcium intake of at least 1 gram per day is required for prevention of osteoporosis, and nutrition, as we've already talked of, should always be seen for. As far as the young girls are concerned, some important vaccination should always be kept in mind before you really go in for marriage or conception. MMR vaccine to prevent rubella infection because it is associated with various congenital anomalies in the baby. This rubella vaccination should be taken and a person should not become pregnant within 1 month or 2 months. Another very important vaccine that has come up is human papilloma virus vaccine to prevent carcinoma cervix or malignancy of the lower part of the uterus. Girls between 9 to 26 years of age should take this HPV vaccine, which comes by the name of 2 names, Cervarix and Gardasil. 3 doses are required, 0, 1, 6, like that. So 3 injections of HPV vaccine will prevent you from getting carcinoma of the cervix. Another important vaccine that one needs to take is Engerix B to prevent hepatitis B at a later date. And most important for today, the COVID vaccine comes by the name of Covishield or Covaxin, which is produced by AstraZeneca and Serum Institute of India. 2 doses, 28 days apart. Only women with allergy and those who are embarked on a pregnancy or are planning to have a pregnancy in a short span of time should avoid taking this vaccine. Otherwise, it is to be taken by everyone because it is going to prevent the severity of the disease at a later date. So all those women in the reproductive age group, if they are planning for pregnancy, please postpone it for some amount of time. Take COVID vaccine and then embark on a pregnancy after 3 months. Aftermaths of COVID disease have been chest pain, joint pain, fatigue, shortness of breath, cough, brain fog, that is difficulty in thinking, headache, depression, palpitation in elderly women. So supporting and protecting older people is our duty. In elderly women, the aftermath of the COVID-19 has been lots of diseases pertaining to heart, diseases pertaining to lungs. So the routine blood checkups, as are already done, like blood sugar, lipid profile, kidney function tests, should be done along with some specialized investigations like transabdominal or transvaginal sonography to see the size of the uterus, the size of the ovaries, and what is the lining, how much is the lining of the endometrium inside the uterus. In the older age group, breast malignancies are quite common. So I would advocate self-breast examination, standing in front of the mirror during taking bath, that one can, with the help of with the palm of your hand, you can do palpation of your breast yourself to see for any mass, and you can pinch on the nipple and see if there is any discharge from the nipple. This can also be, or you can do a sonomammography to pick up some masses or some changes in the breast by sonomammography. A pap smear is a must at latter age of life. To find how much is the osteoporosis, DEXA scan should be done. That tells you about how much is the bone or demineralization has occurred. If a woman has got any mass anywhere in the body, if the woman has got postmenopausal discharge or bleeding, please go to the gynecologist as early as possible. Aging gracefully for elderly women is so very important. And how can we age gracefully? By giving yourself grace, prioritize, create support circles, do some exercises, as we have already discussed, have good sleep, and learn to be comfortable with uncertainty. Learn to live with dignity in COVID. We all want to add life to years, then years to life. And this can be done by aging gracefully. By taking care of the skin with the help of sunscreen and hydration, diet and nutrition we've already seen, doing some physical exercises and being physically active. As far as our mental health is concerned, accept our age. Spend time with loved ones and do what you love to. Lower the stress by exercises, yoga, and talking to friends. Prevent or abstain yourself from alcohol and smoking, and be mindful. Aging gracefully is more about being healthy and happy than keeping wrinkles at bay. Maintain a healthy lifestyle, surround yourself with people you love, and do things that bring you joy. It's natural to worry about challenges that aging can bring, so don't hesitate to speak to someone about your concerns. What to keep following? Wear a mask in public places. Stay at least 6 feet away from people. Frequently wash your hands. Avoid crowds and confined to or poorly ventilated spaces. All these should be followed irrespective of whether you've got yourself vaccinated or not. The term social distancing has found a new meaning, and we all have learned to survive with it. The COVID pandemic has compelled us to change the way we work, the way we breathe, eat, travel, and in short, the way we live. What to keep following, friends? To limit social gatherings, going to crowded places, limit contact with family members outside for work or job, avoid touching surfaces or shared items, remain physically active, and practice healthy habits. Meditation and worship and yoga should be followed. Spend leisure time watching movies, listening to music, read books of our choice. Continue the prescribed medicines, be in touch with the healthcare providers, ensure proper nutrition, boost immunity with calcium, vitamin C, and other drugs. Postpone routine medical visits, seek teleconsultation, and treatment for managing comorbidities and cancer treatment. Ladies and all the girls that are here, be safe and have a great life. Thank you.
Thank you, madam. Your talk was very informative. Now let us move towards the next segment of this today's webinar, and that is dialogue with doctor. Let us move to the next segment, dialogue with doctor. So the students present today are free to ask your queries. Your queries will be discussed. So if you have any queries, please write it in the chat box. Every one of you, all students need not put on your mics on the unmute mode. That will cause a lot of disturbance. Your questions should be typed in the chat box. Other than students, the IFSA members are also free to ask questions.
The chat box enabled?
Yes, it's enabled, madam.
Okay. It shows disabled.
I have enabled it for everyone.
Even students can ask for.
Okay, the students can ask one by one. You can ask questions.
Yes, if they want to, they can come forward and ask. You can unmute them.
Siddhi, please unmute yourself.
Yeah, they can.
Yes, ma'am. Ma'am, actually, I want to ask you that how to avoid mental health challenges after COVID-19 recoveries.
That's what I was telling you all, that for young,
Yes, ma'am.
one needs to keep yourself busy in reading or pursuing your hobbies, doing exercises, which is going to give you a lift. Your mental apathy will go off. You'll feel fresh. And since you are already at home and doing lots of, means you are prevented yourself from socializing, this is going to help you. And talk to your friends either on.
Yes, ma'am. But like, just we are having a joint family, and there are like grandpa and grandma. It is quite difficult for them to accept the things after the recovery. So, what should they do, or what should we suggest them to avoid that depression stage? And like like they are becoming very antisocial after like COVID-19 and all. That's why.
It is a very important aspect for it. There is a big role for you to play now to take care of your grandparents, because you will have to give them a good amount of support, as I told you, because they have to live with dignity. So you have to give them support, you have to boost them, you have to make them have good food, and you have to talk to them lots of times, say after some time, so that they have good conversation with you. Whatever is in their mind will come out. That's the way it can be done. You can take them for a small walk. This can help them in gaining back to their recovery.
Yes, ma'am. Thank you so much, ma'am.
Motivation from your
Yes,
end.
ma'am. Yes, ma'am.
Okay, is there anyone else who would like to ask our doctor?
Anybody else? Where is Pragya, madam? Okay. Any of the participants?
Madam, I have just a small query.
Yes. Sita
Those
madam.
who have hair color allergy, like allergy with dyes,
Mhm.
hair dyes. Can they go for vaccination?
Allergy to the dyes. Yes,
Huh.
they can go for vaccination.
Can they go?
Yes, this allergy to dye need not be allergy to everything.
And when we cut vegetables, we have some skin irritations and all like that.
Skin irritation.
If we cut vegetables
Do you get
like
any
green
rash or
chilies,
do you get any rash or you have itching?
no, just slight burning.
No, then you can go for vaccination.
Okay.
Allergy in the
Thank you.
form of say lot of itching over uh, the arms, limbs, or if the patient is having, or if somebody is really having any papular or macular rash all over the body, then they should not be going in for COVID vaccination.
Okay. Thank you, ma'am.
Any more questions, students?
Yes, ma'am.
Yeah, please. Who's that?
Ma'am, actually, I was on steroids for 8 months, and now I have stopped taking it from last a year.
For
So, is
what
it
you
safe
were on
for me
steroids?
to take the vaccine?
Hey, why you were on steroids?
Yeah,
Why? Why? For what?
for polymyositis.
Polymyositis. Okay. But now you are fine.
Yeah.
And since when have you stopped the taking?
Yes, ma'am.
Since when have you stopped taking steroids?
It's been a year.
Then you can take COVID vaccine.
Okay, ma'am. So there won't be any side effect, right?
No, no, absolutely no. If you have stopped taking steroids
Okay,
a
ma'am.
year back, then you are absolutely eligible to take the vaccine.
Okay. Thank you, ma'am.
Yes, is there anyone else? Do you have any queries? Girls, do you have any queries?
Yes, ma'am.
Huh.
Ma'am,
Yes, Sandeep.
the person suffering from thyroidism can take the vaccine who is on the regular basis of drugs.
Yes, yes, sure. Hypothyroidism is not a contraindication for taking COVID vaccine.
Yes, thank you. Thank you so much, ma'am.
So much anxiety about the vaccine.
Yeah, everybody is so anxious. But let me tell you that this means all
It's
of
yet
us
to
have
come to everybody.
taken the vaccine and things have been quite good. There are hardly any adverse effects of vaccine. Just a day or say 1.5 day, the person has some amount of lethargy, myalgia, and that's all. But then that tells you that it's working.
Okay.
Okay.
With vaccine coming in and a large number of people will receive by
March.
June, March, whatever.
I
We
think
hope
by
to
this
have
time,
ended our
madam,
fight with COVID.
No, I told you just now. Whether you take vaccine or not, you have to keep following all the precautions that I have already told you, that wear a mask always, social distancing, and washing your hands. This is going to be with us for a lifetimes probably.
Can any time frame be predicted for this pandemic to
No,
to go,
because you
or
really
it
are
will
not
be?
able to predict anything because the newer mutations are coming up.
Yeah.
So these mutations which are coming up may pose a challenge later.
Oh.
But
So will
see,
there be
having
another vaccine for these mutants, or the same vaccine
no, as
will
per
protect us?
today, it is advisable to take the same vaccine because the number of patients who had means different type of symptoms, they are not much in number. So this
And,
vaccine is going to suffice as far as it's this day is concerned.
Thank you.
okay. And how do we see India fighting the corona situation as against the rest of the countries?
India is fighting good.
Better than?
Yeah, better than Europe or America because at least the people are following basic norms that have been given by the WHO of social distancing, using of masks, and preventing yourself from going into crowded places, which is very, very important.
Yeah.
And I repeat again, whether you take vaccine or not, you have to follow these restrictions.
For
Really,
quite some time, yeah. So I think we must have a
Madam?
pat on our back for being better citizens.
yeah.
Yeah. And Gadkari madam, you have anything to ask? Or anyone
Has
else?
Madam taken the vaccine?
Yes, yes, I have taken the
So
vaccine.
can you share your experiences, Madam?
Yeah, sure. I have had my first dose, and not only me, my husband, my daughter, and my son, us have had first dose of vaccine, and all of us are doing fine. Only for a day we had some amount of myalgia, for which we took crocin, and there was some febrile episode which was taken care of by that crocin, and we all are doing fine. We were working right from on that day also, and the next day also, and we've been working ever since we took the vaccine.
Thank you,
But
ma'am.
I understand that after the second dose,
Yeah,
it
that's
becomes
what's
little,
been said.
little
But let's
painful.
see, when our turn comes for the second dose, I'll be able to tell you my experience.
Because I heard from my daughter in America, she said the senior friends of ours who had vaccine, first dose they did not complain at all, but after the second dose they had little trouble, not much, but it was little troublesome. So
I
let's
think
hope
that is
it is not
Moderna or Pfizer, I think.
That what they are getting is different, and what we are getting
Yeah, different vaccine
Yeah.
is different. Yes.
No, but
Anyway,
this vaccine is, I don't think will help for the present it may help, but with the new mutations, I don't think it's very good.
that is
Madam,
And the
it
way
will,
it
it
has
will
been
give,
developed, such fast development of the vaccine, I'm not very sure about that also.
but
Because when the vaccine comes out, it takes nearly 5 to 10 years. Isn't it, doctor?
phase 3
yeah.
trials
Yeah.
have been done for a long time actually.
Madam, but what I feel, it will give some kind of immunity after taking this vaccine. So I think the body can fight out the mutants more efficiently.
Actually, it has
Once,
been said that with this vaccine, the antibody titers, which normally were less than one, have gone just one dose. They have gone to. There are lots of people who have done antibody testing, and the antibodies have gone up to 22, which
oh,
is a very good number actually to fight any disease.
okay.
I have one very interesting question for you.
Sure.
Now, see, like a person like me in my 80, I have not gone out for nearly 1 year now. Starting from last month, I went once only to the bank to take the signature on the pension form. Now, if I go out, start going out, how much I will be protected? Because I have not been exposed to any infection, anything. Full care is taken that I'm safe. So, is it advisable to stay at home like this, covered and protected and all that? Is it going to be good? I'm now really scared to go out. I feel if I go out, I'll catch something.
How long you have to keep like that?
True, actually, but keeping yourself like this will be helpful.
Huh?
Keeping yourself like this as you are living today will be helpful
Huh?
to you and preventing you from gaining any serious disease.
That's true, but sometimes I have to go out.
But when you are going out and if you follow all the precautions, things will be
That will
fine.
be okay.
Yeah.
Okay.
It's not that for your day-to-day needs and day-to-day things, if you are going out following all the precautions, most important is hand washing and masking
Okay.
and maintaining social
It's
distance.
not dangerous that
No.
staying so long, all
If
protected.
we follow all the basic principles, then things will be fine.
Okay.
Madam, I have a doubt. Can you mix up with the vaccinated people freely now? When you are not vaccinated and others are vaccinated, can you mix with
Wear
that?
the mask.
It's a
That's
concept
the only answer for
herd
everything.
immunity. Herd immunity, there is a concept of herd immunity. If more than 50% of 55% of the population is vaccinated,
Yeah.
then the chances of the other people or also getting prevented from getting the disease will be there. But we haven't had so much of vaccination in our country, so I cannot comment on that. If more than 55% get vaccinated, then yes.
Hello. 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 Can anyone hear me? Hello.
Hello, Bharti.
Hello.
If there
You
are
can take
any,
over.
yeah, I think there don't seem to be any questions from the students. So we can move on.
Yes.
Yeah.
From the students, we had Siddhi Admane and Sakshi Bhamre. They had queries for the doctors. Now I invite our founder member, Dr. Anuradha Gadkari Madam, to summarize today's webinar.
Hello.
Hello.
Thanks to everybody who has been here, sitting in the chairs patiently for the last nearly an hour or so. It was really a very good experience, Doctor. She gave a very informative, very interesting, and very easy to understand, a real popular lecture. You know, when the doctor starts speaking, sometimes it becomes a little boring. But we were not very bored for a minute even. It was very, really popular and very good. Our girls, the way they ask questions, have grasped it well, it seems. And the way they don't have questions is also very encouraging, in the sense that they understood it. So thank you very much. I'm always very happy when we get learned speakers amongst us and from our own city and working in esteemed institutions to talk to us, giving us information. And we always like to invite them to collaborate with us, join us, so we can spread our wings more. This association, it is Indian Women Scientists Association, is for the women, of the women, run by the women, and giving a platform to the women. And I definitely understand that this Corona has given us an ample opportunity for, it was not good, of course, I don't mean it was a good thing. It was a very scaring and a very, very sad pandemic condition. But it has given an opportunity for those who like to work for the people to see that this zeal for cleanliness, protecting yourself, is continued. It is now, it has come to us. Sometimes I think that we are becoming little more sincere towards our own health. The women are becoming more sincere. Otherwise, we were taking granted that everything is okay. But now we have started thinking on the line that no, we have to take special care of ourselves. So this sort of learning which has come in the pandemic is to be continued, and that can be done by the learned people like you all. It's a very good piece of social work. You can go and address different communities, different individuals, take hold of you, the people working for you in your house, talk to them whether they are really taking all the care, whether they are really washing their hands. It's a small piece of work, but it will definitely increase the sensitivity towards the problem the society is going to fix. Otherwise, we will forget. In like Nagpur becoming a smart city, till that judging is done, then suddenly the smart city number goes up to 1 and 2 and 3 and all that. And when that is over, it comes down to 15 and 16 and 17. It should not happen like that. And that's now we at IWSA stand for this, to create awareness. to make people more aware to the present conditions with the help of science. With the help of science, that's what I'm saying. So let us find out more ways how we can do this more and more with the help of science. And I request my young girls who have come here, can you think of making some posters? Can you think of taking some meetings in the slums? Make some posters, put them on. Put the posters in front of your school. When the people go and come, Srikshawalas, they see the poster and they get reminded that yes, COVID has happened and we have to be alert. Otherwise, they'll forget. I'm sure they'll forget once the vaccination is done, once the incidence comes down, mask will be forgotten, washing hands will be forgotten, social distancing will be forgotten. We have to, as learned people, we have to make sure that it is not forgotten. The message remains. The people in Japan have been wearing masks since a long time. There was nothing, but they were wearing masks for air pollution. And the mask has come handy for them in the event of Corona. Let us try to do something. And thank you very much, doctor. Thank you very much, students who came, who registered and respected our request. And thank you so much, Mahila Nicholas Somalwar College, Principal Seema. Though we have a right on Seema, but we cannot say that you must do it. We have to request her. We requested, and she said yes, and she joined. And she joined with a big group. Thank you very much, Seema. And we hope that you continue with this for all the years to come. I'm again telling you one thing, Dr. Bhalerao, that we would like you to join us. Give us the ways. Join us in a scholarly way. We don't want you to work for us. We want your guidance. We would like to listen from you. We would like to have some new ideas from you for our association, for involving the young girls, for involving our old members also in our task to take science forward, to create awareness, to make the society aware, and lay this seed of education which has come about the protection from Corona, the cleanliness, how to let this grow, how to sustain that. I would like to have your guidance for our association. I think you won't mind, and I think
Sure,
you,
madam.
yeah,
It will be a
I
pleasure
knew
to
that.
meet you all
Because,
again.
yeah, I knew
Yes.
that.
So much.
And let me tell you before I forget, I was really highly impressed with your biodata. I was highly impressed with your national cricket player and your 24-hour solo power flying credit. That's it. You are a doctor and you have done all that. I'm so happy. And I wish the young girls who are sitting there take those 2 points also. Besides becoming a doctor, take those 2 points also. And somebody was asking doctor a question, how to keep the mental health. And I have an answer. That's the answer. National cricket player and solo flying. I don't mean everybody start playing cricket, but take some hobby, take some sport, take something creative so that you remain engaged in that. And this question of mental health shouldn't come to the young minds. Am I correct?
Yes.
Right.
Yes. Of course.
Very correct.
Very correct.
On this
Yes, of
note,
course.
I think I'll again thank you all, and again request you all to participate actively in all the endeavors we come forward with all the ventures ITSA comes forward with to your college, and for the help from your college principal and from you all. You please help her when she comes to you first to do something for the association. And we look forward for you to be with us again and again. Thank you so much. And thank you, Dr. Bhalerao. Thank you, Pradnya, for
Thank you,
suggesting
madam.
Dr. Bhalerao,
Thank
Pradnya, for suggesting Dr. Bhalerao, your daughter-in-law. You must be very proud
Oh,
of her.
thank you, madam. Thank you very much. It's
Thank
your
you,
blessings,
Seema.
madam.
Thank you,
Yeah,
Seema.
it's your blessings.
Thank you, Rita. Thank you, Bharti. Bharti, thank you very much. A
Thank
very
you,
good
madam.
job done.
Thank you, madam.
Thank you so
Thanks,
much.
madam, for
And
blessing
thank you
us.
all those who have helped and whose names I don't know because Seema doesn't tell me everything who has helped. She'll tell me afterwards because she herself doesn't like praise. That's one thing. She says, no, 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 no. But I thank everybody, and I always tell Seema to thank everybody on IFSA behalf. Thank you
Yes,
very much.
I will.
So much, madam, for all of you being so wonderful. Thank you so much.
Dr. Anuja, you will excuse us for calling you Dr. Anju. I made a mistake in the beginning. I realized it now.
Yes.
Okay.
Okay.
Bharti, please
So-
go ahead.
Okay, thank you, Gadkari madam. You have even inspired our college girls. Now I call upon Asmita Durakkar for vote of thanks.
Very good afternoon to one and all present on this virtual platform. I, Asmita Durakkar, member IFSA, on behalf of Indian Women Scientists Association Nagpur chapter, Nicholas Mahila Mahavidyalaya, would like to propose vote of thanks for today's popular science lecture. At the outset, I would like to thank today's esteemed guest speaker, Professor Dr. Anuja Bhalerao, for taking out time from her busy schedule for this awareness talk. Thank you for educating young generation and updating the aftermath for aging generation. I'm pretty sure these inputs will definitely help us in practicing healthy lifestyle. Once again, I thank Dr. Anuja Bhalerao. Thank you, madam. I would like to thank Dr. Pradnya Bhalerao, convener IFSA, for her constant encouragement. I extend my sincere thanks to Dr. Seema Somalwar, program coordinator and principal Nicholas Mahila Mahavidyalaya, all of us. I offer heartfelt thanks to Dr. Anuradha Gadkari for summarizing today's talk. Israni, senior member IFSA, and Dr. Bharti Ganu, treasurer IFSA, for their valuable contribution in organizing this program. I want to thank students of Nicholas Mahila Mahavidyalaya for their enthusiastic participation. All for joining this event. Thank you again. Over to Ganu madam.
Thank you.
Thank you. So we conclude here, madam, today. Thank you, Dr. Anuja. Thank you, all of you. I think we
Sincere
end on
thanks
this
to all
today.
the students, all the girls and students and Nicholas Mahila. Thank you very much. Thanks all.
The whole thing has been recorded. The whole session has been recorded. So
Oh, that's good.
yeah, so if anyone wants to see it, so they can even see it again. Like it's recorded. It's on the cloud now.
May I know how many registrations did we have in all?
We had 70 registrations.
Very good.
Oh, very nice.
Happy. Very good. So the first lecture in the popular science lecture series BRN has been a good success.
Yes.
And we continue with this for the rest of the 3 lectures which we are going to follow with this after this.
So we conclude our program.
Yeah.
Okay.
I think so.
Thank you all.
Thank you.
Thank you, Bharti. Thank you, Bharti, for conducting
Thank
the
you.
program so efficiently and for looking after all the technicalities of the program. So my sincere thanks to you.
Thank you.
Thank you,
madam.
Bharti.
Thank you.
That was very good. Thank you.
Thank you. Bye then.
Thanks a lot.
Thank you.
Thanks all.
Okay, thanks.